try to tie this back to lessons from COVID, innovations from COVID, and how that will help with the workforce problem. As you said, workforce connects with all the issues. So, what's your view?
Yeah, I like how you frame that question, because COVID's been this awful thing, right? Everyone agrees with that for a dozen different reasons. But COVID has also had a number of silver linings. I've viewed it, COVID, for the last couple of years as a giant sort of regulatory reform pilot program, because there is a lot of regulation, both at the state and federal level, much of it around telehealth, or locations where care can be delivered, that was waived. And we've learned a lot of lessons from those regulatory waivers that I think can serve us well going forward, especially as it relates to access to care and utilizing the workforce that we have. So one example, telehealth is, I won't repeat what others have said. Telehealth has been great to increase access to certain types of primary care, definitely behavioral health care, no question about that, for a lot of different reasons. But it's also expanding access to more acute types of care. So think about, for example, a program called Hospital at Home. I'm looking at Mayo over there. Hospital at Home is primarily a Medicare, now a Medicaid program that allows lesser acute inpatient, hospital inpatients to get their care in their home. And that's not a primary care visit, that's a little more intense. But it's not just a face-to-face interaction. It's the technology that's there. It's the monitoring technology that's there. There is a visit in person by a physical nurse. But that's one example. And why is that one in particular important? Because it's allowing hospital capacity, which is far more than just beds. It's the staff for those beds, which long-term care has been a real challenge on. It's a way to allow hospital capacity to be used for people that really, really need inpatient hospital care. So I could go on and on about some of the really positive outcomes from COVID, many of which are in that sort of regulatory reform space that we're now working on trying to make permanent.
Yeah, talk more about the licensing. You said, you tossed that off as like, there's a teacher crisis too, right? And so it's easier than it used to be, but maybe not as easy as it should be to teach part-time or whatever. So what about the licensing piece that you were referring to? I need to hear you expand on that.
Yeah, it's a particularly frustrating problem, because what we have is a significant demand for care that to varying degrees is not being fully met because of our workforce. A lot of different issues too, but because of our workforce. So when you have hundreds, if not in the thousands, I'm looking at Ann Zenk over there, who's our chief licensure officer. She doesn't know if that's her title. When you have so many people that want to provide care in this state, but for various reasons can't get through that licensure process, that makes it even that much more frustrating. Is that a solution to our problem? No. But it certainly is a problem that should exist to the least extent possible. So there's, I think in the next legislative session, there's going to be a big debate in the state budget about resources for Department of Safety and Professional Services. There's going to be a big focus on licensure reform. And I see Gina nodding down there. She knows what I'm talking about. How many hoops and hurdles do we need people to go through to not only be a healthcare provider, but also, by the way, a healthcare educator? I throw that in there also.